Good afternoon. I am Sonia, Department of Psychology. So today I am going to teach about mental retardation. So in this video I am going to cover these topics. Okay. So before going to the topic, I would like to say about what is mean by DSM. First, I would like to say what is mean by DSM. So DSM means Diagnostic Statistical Manual of Mental Disorder. So this is a book. It is a authoritative guide for mental disorder. So in this book they mentioned as, so actually it is not a mental retardation. Actually it is a intellectual disability. So in DSM-5 it is mentioned as intellectual disability. So now I am going to teach about. Okay, so what is the nature of intellectual disability? So first I would like to explain what is meant by intellectual disability. So intellectual disability means the person having problem in mental functioning. So mental functioning and communicative, take care of himself, herself and social skills. So the person will be having problem in this. So the next one is if the person, so the person having intellectual disability means when compared to the normal person, their development level, so their development level should be very low. So next one is this type of people having deficit in cognitive functioning and adaptive behavior. So the next one is if the person having severe intellectual disability means the person will be affected by development, so they can't be able to cope up with the social skills, everything. So in schools also they can't be able to cope up with their skills. So next, okay, so next in previous picture I said about intellectual functioning. So what are the deficit, what are the intellectual functioning we can see in this topic? So first one is deficit in intellectual functioning. So that is reasoning, problem solving, planning, abstract thinking, academic learning and learning from experience. So this everything should be problem for them. So that is intellectual functioning. So the next one is adaptive functioning. So what is meant by adaptive function means the person having problem in communication. So they can't able to communicate properly. If it is mild or moderate means they can able to cope up. But when come to intellectual disability, when come to profound people means they have severe communication skills problem. So next one is they can so if it is a mild and moderate intellectual disability means they can cope up with their day-to-day life. But it comes to profound and severe means the person will be affected by day-to-day activities. They can't able to brush within himself. So likewise the problem they can face. So when we can find out this problem means in the infancy. So in the infancy they have mild symptoms. If we can't able to find out means then when we can find out means in the childhood. So when they are going to school, after that only we can find out the disorder. So onset means we can say it is on childhood. So next, so prevalence of intellectual disability means it is called as statistics. So out of 3% of people, 1% of people were affected by intellectual disability. So here you can see approximately 6.5 million people were affected by intellectual disability in United States. So next one is in Philippines. So in Philippines, intellectual disability comprise in 7.02%. In total population, there will be 7.0%. Okay, so this is intellectual disability in DSM-5. So there is here two books. So one is DSM, the other one is International Classification of Disease. So it is used in moreover every places, but in the international classification disease book were used in worldwide. So in this book they mentioned about 3 domains. So one is conceptual, social and practical. If the person affected in this means they will be having intellectual disability problem. So in international classification of disease, in this book they mentioned that if the person having intellectual disability means the person must have some other disability also, not only disability, any disorder also. So it is mentioned in international classification of disease. So here you can see. So mental retardation may be accompanied by physical or other mental disorders. So next. Okay, so next we are going to see about there are 4 types of mental retardation are there. So there is a lot of assessment for assessing the mental retardation. So mental retardation means intellectual disability. So the first one is if the person score 50 to 70 marks in the intelligent test means the person will comes under mild mental retardation. If the person comes under 30 to 50 scores means the person will be affected by moderate intellectual disability. If the person is 20 to 40 means the person will be affected by severe intellectual disability. So the last one is below 20 or 25 means the person will be affected by profound intellectual disability. So we already know that if the person is getting 100 percentage, 100 scores in intelligence level means the person will be having average level of intelligence. Okay, so in DSM and ICD, these are the codes. So in the book you can see in F70 it is mild mental retardation, and it is F71 means we can say moderate mental retardation, then 72 severe mental retardation, 73 profound mental retardation, and 78 it is other mental retardation. So even not only the four things, we have more than also. So even some things are not specified. So unspecified mental retardation also there. So these are the codes. Okay, so next one is mild mental retardation. So large number of people comes under mild mental retardation. So whatever it is, if they are educable adult also, their education level should be 8 to 11 years old. So whatever it is, if they are in college also, when we are checking their education capacity means we can see they should be in 8 to 11 years old. Okay, so next one is they have so they can able to cope up with the day-to-day life, but what is the issue means they have problem in studies, so they need some supervision. So if we are giving some supervision to them means they can cope up with their day-to-day lives. So this is thing we can see. Next one is they can't able to, they don't have any physical characteristics, so they should be look like very normal persons. Okay, so their reading maths skills should be in grade 3 to 6. So the person is 18 or 19 years old also, their education level should be in 3 to 6 grade. Okay, next one is moderate. Moderate MR means if this person also need education training. Okay, so we want to give training to them. Here you can see the person was anything. So the person is adult or adolescent anything, but their education level should be in 4 to 7 years old. So next one is they have mild noticeable developmental disabilities. Next one is able to learn, so they can learn the day-to-day activities. If we are teaching them means they can able to cope up and even they can learn this. Okay, so this is moderate mental retardation. So next one is severe intellectual disabilities. So severe and profound means the person having difficulties. So they have more difficulties when compared to mild and moderate. So here you can see severe intellectual disability means the person having motor speech development problem also. Even they have some sensory deficit also, and they can't able to speak properly. So mostly we can see this type of people will be affected by speaking problems. They can't able to speak properly. So next one is they have some problem in developments. So delay in developments, and they can't able to communicate easily or properly. And then if we are teaching about day-to-day activities means they can learn, but daily we want to teach them. So that is the main problem in severe intellectual disabilities. So this person definitely they need some supervisions. So next one is profound. So profound is the last and severe case. So in this case, so IQ less than 20, the person's scores should be less than 20, and their development should be very low. So what we can do means this type of people we need somebody to take care of them. So for severe and also we can give some training, but when we coming to profound, so we need some supervision. Not only supervision, we need somebody to take care of themselves. That people's. Okay, so next they have problem in their developments and everything they have some problems. So after that they can't able to survive without anybody. So they need somebody to take care of them. Okay, so this is all about the types of intellectual disabilities. So next one is symptoms. So I already mentioned about the types in infancy. In infancy onwards, we can find out the person's mental retardation. So the child mental retardation. So these are the symptoms. If the person, we already know. So the infancy is developing means we know. So in this stage they want to develop it like this. So likewise we know. So here you can see rolling over, sitting up, crawling or walking late. So this type of things are becoming late means we can find out the person is having some issues. So we can suggest with doctors. So next one is talking. So in infancy or in 1 year means the child start saying some words, so babbling, so they start saying some words. But in this type of children, in 2 years also they can't able to tell any words, so they can just say something little words, that's it. So they learn everything everything very late. So potty training, dressing, feeding himself, so everything should be late. They can't able to learn easily. So next one is inability to connect actions with the consequence. So they can't able to connect with anything. Okay, so they have behavioral problem and they have difficulty in problem solving and logical thinking. So these are the symptoms we can find out in infancy onwards. Okay, so the next one. Okay, so next one is causal factor. So why the person affected by intellectual disability? So I am going to say about what are the causal factors of it. So first one is genetic chromosomal factors. If the person affected, if the person having 12 chromosomes, so in the person 21st chromosome is affected means they will get mental retardation. So this is here, and also the family poverty and socio-cultural deprivation also affect their genetics. So next one is infections of toxic agents. So if the mother, when the mother is pregnant, so they are taking lot of alcohol. So excessive of alcohol, it also affects the child intellectual disability, intellectual level. So next one is brain damage. So if the after the born of baby, they are in the toxic places, so like a high level of carbon monoxide. So likewise means it also affect the child. So next one is physical injury. So when the mother is pregnant, the delivery time, so if there is any issues means it also affect the intellectual development of the baby. So this all comes under physical injury. So next one is ionizing radiation. So in pregnant time, some of the people are keep on taking a lot of scans, X-ray. So monthly once it is good, but when the person is taking keep on lot of X-ray means it also affect the child, X-rays and malnutrition. So some of the if the fetal irreversible physical and mental damage, it also affect the baby's curiosity and motivation to learn. So these things they will be reduced. Okay, so the next one is problem during pregnancy. So if the mother is taking too much of alcohol or she was taking any drugs, so it also affect the baby. So next one is problem during childbirth. So there in the delivery time, if the mother is getting lot of pain or the cesarean or anything else they are doing means it also affect the baby because they are taking baby. So yeah, the child it is very sensitive. If they are taking with a vacuum or anything means it also affect the baby. So next one is illness or injury. So when the child is born, there is any illness or injury also, it will affect their intellectual ability. Okay, so next one is cranial anomalies. So not only this intellectual disability will be affected by only intellectual disability. Even some of the disease also can be collaborated with it. So the first one is macrocephaly. So it means the person will have large head. So in this picture you can see. So it is macrocephaly. So the child will have large head, and what is the problem they have means they have visual impairment and neurological symptoms, and also the child will have intellectual disability. So next one is microcephaly. Microcephaly means the child has small head. So what is the issue means in cranium. So in cranium it is not attain the normal size. So that is the main reason they have this problem. So next one is hydrocephaly. So hydrocephaly means in cranium there is a cerebral. So abnormal cerebral spinal fluid is there. So that will affect the baby. So that's why the baby is getting hydrocephaly. So these are the causes why the child is getting this problem. Okay, so next. Okay. So as a psychologist, not only they can cure this problem because they want to collaborate with some other therapies also. So the first therapy is occupational therapy. So what the occupational therapy will do means they will give training to self-care themselves and employment activities, leisure activities and domestic activities. So these are the training given by occupational therapy. So next one is speech therapy. So I already mentioned that this type of people will affected by speech, so communication skills problem. So this speech therapy will give them improve communication skills and so expressive language skills, improve speech articulation and improve vocabulary. So this everything will be done by this speech therapy. So next one is physical therapy. So they can give so movements, everything they will give training. Okay, next one is orthomolecular therapy means the person, so it is comes under nutrition. So what they can do means, so molecular balance via nutritional supplements. So they will give some diet plan. So it will help to reduce the child intellectual problem. So next one is medication. So here they mentioned about nootropic. So nootropic is a medicine, but what happen means it is not suggestible. It is just try to improve the child's skills. That's it. Okay, so it is not at all true. So just they are giving to improve people's learning abilities is a growing area of interest. So that's why they are giving this medicine. So next one is talk therapy. So this type of this disability we can't able to give we can't able to give therapies. So we can give some talk therapy because why we can't able to give the psychotherapy means the person already they have problem in their intellectual disability. So that's why we can't able to give psychotherapy. So in this time we can give some talk therapy. So I think talk therapy will be more effective for them. So here we can give the training to them cognitive, emotional and verbal ability. So it will be helpful to reduce their intellectual problems. Okay, so in last, okay, so I would like to conclude with this word. So MR is not a disease, it is a condition. So actually it is not a disease because we can't able to cure it. The person will have this disorder in lifelong. But what we can do means we can modify it. So we can't able to cure, but we can modify. Okay, thank you.